Are you someone struggling with pain in the front of their hip and you are tired of trying all the different things you found online and you're just frustrated? We can help. I'm Dr. Dukes with Body in Motion. This video is going to explain how we assess the front of the hip. It can be pretty complicated for some people to understand what it is we're working on. There are some variable factors that we need to look at for most people. One thing, we sit way more than we ever have in the past. And so we need to take that into consideration no matter what the activity you choose to do that might have flared this. So when we're thinking about the front of the hip, we need to understand that most people are spending a lot of time here, right? So that's the first tissue that we look at is the hip flexor. And the weird thing about the hip flexor, it's a lot like what we used to think about the calves. It doesn't always just need to be stretched. Yes, it feels good, but it may not actually move the needle to make you feel any better. So it may be feeling tight, but your body's actually weak there, and we need to strengthen it. So sometimes the assessment's going to show us that we've got an imbalance, and we need to strengthen one side over the other, or potentially both. And then we move on to look at impingement to the front of the hip, or labral tears, and dysplasia, which would be instability. And then we start to look at how good are they on one foot? Can they hinge? If both legs are down, do they feel any pinching? When we're looking for that, we're trying to assess, is it internal rotation? Is it loaded? How do we move the hip to replicate the symptom that that person's feeling? At the end of the day, we're looking at increasing strength of the hip flexor, potentially bringing the glutes in to help that out, but also the lower abdominals, and then devising a plan that might be stability-based or mobility-based to help whatever problem it is. So we see this commonly in runners and also cyclists. It just depends on what tissue we're looking at most of the time is the problem. So at the end of the day, is it stability-based? Is it mobility-based? Those help us to move the needle on something that could be an internal derangement that we may not be able to change that hardware problem, but we can also make you feel a lot better in the process. So if you have some pain in the front of your hip and you're struggling with trying to figure out what to do and you don't want to jump to surgery right away, give us a call and schedule an appointment.